It is that circular line which is passed from the tips of the medial and lateral malleoluses. From downwards, the same circular line from the base of the lateral and medial malleoluses. Let's say this is the region of the joint. Ankle joint region divided not in two, but it is divided into four regions. Now look here please. Anterior ankle joint, which is located between anterior margins of medial and lateral malleoli. Medial ankle joint, which is between posterior margin of medial malleoli and Achilles tendon. Lateral malleoli region, between posterior margin of the lateral malleoli and Achilles tendon. And finally, posterior ankle joint, it is included the region of the Achilles tendon. Let's say this region divided not into two like usually, anterior and posterior, but it is divided into four compartments: anterior, medial, lateral, and posterior. Let's start from anterior compartment. Now we don't write anything, just listen. Skin anteriorly is elastic, it is thin, it doesn't cover by the hairs, it doesn't contain sweat and sebaceous gland, because this is the joint region. Any inflammation of the mentioned structures can make the movement here impossible. When I say thin, it doesn't mean that it really thin. It is thinner comparable with posterior region. Subcutaneous fatty tissue is bad developed. In subcutaneous fatty tissue, we have superficial structures. Number one, in the level of anterior margin of the medial malleolus, we have vena saphenum magna and nervus saphenus. In the level of the lateral malleolus anterior margin, we have the branches of vena saphenum parva, not the main trunk, but the branches of it. Also inside of the fatty tissue of the lateral portion, we have nervus peroneus superficialis. I tell you that in upper middle thirds, it is located inside of the lateral osteofacial compartment. In lower third, it is going to subcutaneous fatty tissue. And it is continuous to in fatty tissue and in ankle joint region, and it is located in anterior ankle joint near the anterior margin of the lateral malleolus. Let's say we don't make the picture of the lower third, but for yourself you can write or remember that structure 21, which I draw here inside of the lateral osteofacial compartment, in lower third come to the fatty tissue. And in fatty tissue, it is continuous to the foot region. By the way, one more change we will have in this picture. In the lower third, nerve 17 will become medially to artery 16. That is two changes which we have between middle and lower third. First of all, 21 come to the fatty tissue, and secondly, 17 goes to the medial side. So you can see that 17 make rotation. Upper third is located laterally to artery, then in front of artery, then medially to artery. The same, if you remember, we have between nervus medianus and arteria brachialis. Yeah? Upper third it is laterally, then it is in front, then it is located medially. Here we have approximately same. Let's continue. This is about subcutaneous fatty tissue. Superficial fascia doesn't have any specificity. Proper fascia. Proper fascia is thick near the upper border of the region and near the lower border of the region, and it forms two ligamentous structures, which we call ligamentum extensorium or retinaculum extensorium superior and retinaculum extensorum inferior. What does it mean? It means this is two ligaments which is fix the tendons of extensor muscles, which is located behind of them. Which tendons of extensor? Tibialis anterior, extensor hallucis longus, extensor digitorum communis, which is located in anterior osteofacial compartment. By the way, superior retinaculum mainly fused medially to the tibial bone, laterally to the fibular bone. By the way, behind of this retinaculum, except the tendon of extensor muscles, also partly past the tendons of peroneal muscles. But peroneal tendons, part of this retinaculum, which is covered the peroneal muscles, it is located in the lateral compartment. It is called the peroneal retinaculum. But generally it is continuation, one to another. But it is located not in anterior, but in lateral ankle joint region, because peroneal tendons pass in the lateral osteofacial compartment, in lateral ankle joint region, not in anterior. But really, it is continuation of the superior retinaculum. Inferior retinaculum, it has the cross-shaped form. Medially, it is split into two legs. Laterally, it is forms one leg. Lateral leg, it is fused with the calcaneus bone. Medial one divided into two portions. Superior one fused with the medial malleolus. Inferior one fused with the first tarsal bone. As I remember, please, it has the Y-shaped form. Upwards in the medial side, it is fused with the medial malleolus. Downwards, it is fused with the first tarsal bone. Behind of them, you can see tendon of extensor muscles. By the way, superior retinaculum and inferior retinaculum gives two septa, which is split all the space into three osteofacial canals: medial, middle, and lateral. Now look at please. Inside of the medial canal, we have the tendon of tibialis anterior. Inside of middle canal, we have the tendon of extensor hallucis longus. Inside of the lateral canal, we have the common synovial sheet of the tendons of extensor digitorum communis muscle, which is split into four portions, from second up to the fifth fingers. Between second and third canals, we have the anterior tibial neurovascular bundle, arteria tibialis anterior, together with nervus peroneus profundus. By the way, in this region, arteria tibialis anterior, we rename and we call it arteria dorsalis pedis. Arteria dorsalis pedis. How we projected this arteria dorsalis pedis? From upwards, it is midpoint of distance between two malleoli. From downwards, it is first interfinger space. So you make communication between them, and by this imaginary line, we make the projection. By the way, between right and left malleoli, 2 centimeters below, we have the pulsational point of arteria dorsalis pedis. Here, if you will push it to the tarsal bone, you can simply palpate the pulsation of it. Idea is understandable for you. That is what I want to say you about the anterior region. Now look in this picture, this is the medial ankle joint region, borders. From anteriorly it is the posterior margin of the medial malleolus, from posteriorly it is the Achilles tendon. Subcutaneous fatty tissue is better developed than in the anterior region. Skin is also thinner than posteriorly, it is elastic, it is movable. In subcutaneous fatty tissue we have branches of vena saphenum magna and nervus saphenous, main trunks located in anterior region. In medial region we have branches of it. Superficial fascia doesn't have any specificity. Proper fascia. Proper fascia here, guys, anteriorly fused with medial malleolus, posteriorly fused with the calcaneus tendon, and it forms the retinaculum flexorum, the fixator of flexor tendons. And also it is included in formation of canalis malleolaris. What is the canalis malleolaris? It is the space between these two bones. Anteriorly it is posterior margin of the medial malleolus, posteriorly it is Achilles tendon or calcaneus bone. It will be the same, and from superficially it is the proper fascia which is communicating these two bones to each other. Inside of this canal we have tendons of three flexor muscles. From anteriorly to posteriorly, it is tibialis posterior, it is the flexor hallucis longus, it is the flexor digitorum communis. Between last two muscles, we have posterior neurovascular bundle of the leg region, arteria vena tibialis posterior and nervus tibialis. Inside of the canal, they split it into two terminal branches. Tibialis posterior gives plantaris medialis, plantaris lateralis, nervus tibialis gives plantaris medialis, plantaris lateralis. And together they form two neurovascular bundles, medial, plantar, and lateral. By the way, nerves located from the sides, vessels located between them. That's for medial one, nerve has more medial position, for lateral one, nerve has more lateral position. As I remember this picture, two plantar nerves, between them two plantar vessels. And they form two neurovascular bundles, medial one and the lateral one. I think it is simple. Let's continue quickly, guys. Next region, right, please. It is the lateral region of the ankle joint. Skin is thicker than in previous two regions. Subcutaneous fatty tissue bed developed as in anterior region. Inside of the subcutaneous fatty tissue here, we have terminal portion of vena saphena parva and nervus suralis. If you remember, in the leg region, they located posteriorly. In the ankle joint region, they come to the lateral compartment. That's once again, vena saphena parva and nervus suralis. Superficial fascia is better developed. Deep fascia, if you remember, I say you that continuation of our superior extensor retinaculum here, we call peroneal extensor. And under the peroneal extensor, you can see it greatly here, it is continuation of one to another. Medially, it is fused with the fibular bone. Laterally, it is fused to the calcaneus. And under of it, there are two tendons. By the way, inferiorly also we have peroneal retinaculum. Again, it is continuation of the inferior extensors. Let's say both extensor retinaculums continues to the laterally and forms peroneal extensors. What is important of these extensors? Under the superior extensor, guys, both peroneal muscles located in the same synovial sheath. Under the lower extensor, they split it into two separate synovial sheaths. By the way, they make external rotation. Then they constrict it, your foot make external rotation, like this. This is internal rotation, that is external rotation. That's it. Under the superior retinaculum of peroneal muscles, there are common synovial sheaths for both these muscles. Under the inferior, there are two separated synovial sheaths. Finally, they come to the base of the first tarsal bone, fuse with them and finish in this level. They doesn't go to the fingers. They finish in the level of the tarsal bones. Idea is understandable for you. Very well. Finally, we come to the last region. It is the posterior ankle joint region. Time is enough. It is coincide with the sizes of Achilles tendon. That's why then we say posterior ankle joint. Otherwise, we can say it is the region of the Achilles tendon. Thickest skin. Skin is less elastic and less movable than in previous regions. Subcutaneous fatty tissue not good developed, but inside of subcutaneous fatty tissue we have synovial buccas. Here in the level of the Achilles tendon we have two important synovial buccas. One is located superficially to the tendon, second located between the tendon and calcaneus bone. One we call superficial synovial bursa, second we call deep synovial bursa. Both these bursas decrease the friction and make the movements in this joint much more simple. Let's continue. Superficial fascia doesn't have any specificities. Inside of the fatty tissue, we forget to mention that laterally we have the terminal branches of saphena parva. Medially, we have terminal branches of saphena magna V. So here we have terminal branches. Proper fascia forms the capsule synovial sheath for the Achilles tendon. Under the proper fascia and Achilles tendon, between tendon and between calcaneus bone. By the way, Achilles tendon attached to the tuberositas calcanei. It is the tuberositas of the calcaneus bone. And between them, we have the deep synovial bursa. For the females, especially, who wear the shoes with very high heel, this region chronically irritated, it can give the formation of the bursitis, Achilles bursitis, which gives the chronic pain in this region. That's all, guys. Foot region, I don't have enough time because after 6-7 minutes I will finish the class. You will read it self-independently. If will be questions all next week, I will be here. Generally, look here, please. Foot region, Superiorly, it is bordered by circular line, which is passed by the base of the medial and lateral malleolus. Inferiorly, it is tip of the fingers. Now you provided two imaginary lines, one along the first finger, medial surface, second along the lateral surface of the fifth finger and foot. And you divided all foot into two surfaces. Yeah, plantar surface and dorsal surface. Dorsal we call anterior, plantar we call posterior. Here you must attract your attention into the vascularization and innervation. Anteriorly we have the arteria dorsalis pedis and its branches, which is gives to the fingers, and we have nerves. It is nervus saphenous, nervus peroneus superficialis, which is common to subcutaneous fatty tissue, and the terminal branches of nervus peroneus pulmonis, which is involved in the innervation of the fingers from dorsal surface. In the back side, in the plantar surface, as I say 2 minutes before, there are two neurovascular bundles, which is located under the proper fish. It is the medial plantar neurovascular bundle, it is lateral plantar. They forms together two arterial arches, superficial and deep. Superficial located just under the proper fascia, deep is located under the tendons of the plantar surface. Let's say read it please, it is not so hard, it is very simple. Do you have any questions for me?